Because of this new data that has been collected from Indonesia, where the practice has been banned since 2006. Maria Osman is Australia's 2015 official delegate to the United Nations Commission on the Status of Women, and she was the keynote speaker at a conference on the prevention of the practice in Melbourne today. We spoke about the scale of the problem worldwide.
I think that when I was at the United Nations in March, we had a sense that it was declining. The prevalence was in fact declining. And I had a quick look at that report today when it came out, and I think it's because of the inclusion of Indonesia. So the data now collects Indonesian data, and some of the data mechanisms around the world maybe are better at collecting it. But it's a very, very troubling figure. I agree.
And it's actually been banned in Indonesia, which has been a bit of a surprise that it is still continuing.
Well, we say even within Australia, you know, we have laws, and there are many countries that are members of the United Nations, and many countries have banned it and outlawed it. There's a number of countries that still have not outlawed it. So setting the legislative framework is the first step, and after that we have a lot of work to do.
There are countries, of course, that practice more extreme versions of genital mutilation. So that in itself is too a bit of a challenge. What did the UN consider when you were discussing this back in March?
Well, there was a very strong voice from young women from around the world, and I think that was great because we had women like myself who've worked in human rights for a very long time, and young women coming to talk about their experiences of female genital cutting, circumcision, mutilation. Even the language is very complex around this issue. But for the really inspirational work was around alternative rites of passage, because in some communities you might not get married, you might not have opportunities in the community that you live in if you haven't had this practice. And we have to remember it's a cultural practice that has been operating for many, many years. So it's going to take a long time to change attitudes and to change those values around.
And in many ways, the women are complicit in this practice as well, as you say, to be for their children to be accepted and to be married off. So how do you change it at a grassroots level?
I think it's about community ownership and leadership. I think empowering young women and girls in education, that was a very strong theme in New York at the United Nations. And I think the other one is alternative rites of passage. What else can you do to make yourself more marriageable? Because that was some of the issues. And we met incredible women from Kenya, from Somaliland, who were talking about these different ways of doing it. But ultimately, we need legislation. We need training of health workers, because often the first time that the issue arises is when a woman is pregnant and about to have her first child. So how do we train healthcare workers, maternity workers and doctors and gynecologists to understand this issue? It's quite complex.
And at the conference today, what were some of the issues that you were grappling with?
There was a lot of issues around terminology. What do we call it? People don't like the word mutilation. Communities that are affected by this practice were present at the conference, and they were very strong about what we say and how we talk about it. I felt very confident.
Is that because of a stigma attached to it, or why? I mean, it is what it is.
It's the stigma, and if we have a stigma, it will go underground. So what we want is communities to feel confident and empowered to deal with the issues and take the issues on themselves. They are best to understand how to communicate the issues to their own communities. And there's very wide-ranging communities. There was also a very strong theme that within Australia we stigmatise those countries in Africa. And as we can see from the report today, Indonesia was a very high statistic from Indonesia, and Asia, South America. So we need to really be careful how we work with communities. But they were very optimistic about the work that they're undertaking at the grassroots level. They're very pleased that we have legislation in this country and training. And also we have the highest commitment from the Minister, Honourable Michaela Cash, and Natasha Stott-Despoja, the Ambassador for Women and Girls. So we have strong leadership and good grassroots work going on in Australia.
And how much of a problem is it in Australia?
That was discussed. So we discussed the data collection, and the data is just not good data. So it's actually very difficult to talk about the issue of what is the figure. And I'm often asked how many women. So we don't know. What we do know is that women present at maternity hospitals or present when they're pregnant, and that's the first time the medical system has come into contact with those women. So we need to ensure that they are empowered to understand how to talk to the woman, how to support the woman. But statistics, we don't actually have any statistics in Australia.
Maria, really good to get your thoughts on this topic. Thanks for joining us.
Thank you.